Greetings, everybody. Welcome to the second this year's second academic year series of Leadership Matters webinars. My name is Les Stein. The Master of Science in Organizational Leadership team and I are proud to host this series of webinars, and we certainly hope you will enjoy and benefit greatly from the words of our distinguished panelists. I also hope that you will generate questions in our chat box to keep the discussion both meaningful and lively. Last summer, I had an opportunity to visit the National Museum of Civil War Medicine in Frederick, Maryland. I was intrigued by the section that addressed healthcare heroes. This part of the museum not only recognized the frontline healthcare providers during the Civil War, like doctors and nurses, but it also included people who often worked in the shadows, like those who helped create and improve prosthetics, sought advances in field sanitation, and worked in research, training, and education capacities. Since then, the healthcare field has grown exponentially, and in the past 2 years, it has received more attention, both positive and negative, than ever before. I would argue that the success of our healthcare industry globally is the product of leadership. The moderator for our webinar is my esteemed colleague and friend, Dr. Sriram Rajagopalan. He's an accomplished practitioner and academic, having authored a book titled Organized Common Sense and multiple journal articles. Sriram, it's all yours.
Thank you very much, Les, for setting the stage and a wonderful introduction over here. And the stage is primarily set here for Leadership Matters, which is exactly what we want to focus on, Leadership Matters. And the focus is within the healthcare space, how it matters. Now, as part of Northeastern University College of Professional Studies and the Master of Science in Leadership program, it's my honor and privilege to welcome our panelists, Bill Lucia, Suga Subramaniam, and Samir Bapat. Now, they all have their own individual expertise. If I start going through that, that will probably take 1 hour for each one of them. So I'm going to leave a small time for their introduction. Bill Lucia was the CEO of HMS, a leader in healthcare analytics, and he served in that capacity from 2009 to 2021 for quite some time. During that time, he transformed the organization of over 3,200 employees, north of that, into a very high-performing culture. And with 50 healthcare payers, more than 500, in fact, healthcare payers, and 50 government agencies across more than 40 states, supporting about 31 or 38 private healthcare insurers in Australia, and growing the company to a $673 million in assets. So, Bill, can you do the honors and wave for the audience so that they know who you are? Awesome. Thank you, Bill. Appreciate that. Suga Subramaniam is an expert veterinarian and also an immuno-oncologist, applying her combined skills in both the scientific domain as well as in the bioinformatics domain towards the drug discovery of all different stages. And she has contributed to many commercially viable drugs at this point. And she focuses primarily on developing for solving tomorrow's health problems today. Suga, can you please, wave for the audience for us? All right, thank you, Suga. And Samir is a result-oriented delivery leader with, 20 plus years of experience, primarily in the healthcare IT sector. That brings 2 different domains. One is healthcare, the other one is the IT, brings a combination of skill set into this. And Samir led an entire 180 plus member business unit as an expatriate in India, and managed product development, portfolio management, service delivery, and many, many things. With an entrepreneurial attitude, Samir applies his knowledge in multiple domains, delivering people and teams on project management, program leadership, vendor and stakeholder management, and many other sectors. Samir, can you do the honors and wave for our audience? Thank you. That's Samir. All right. Now, Bill, Suga, and Samir, I have worked with them in different capacities or engaged with them in different roles in my career. They primarily are here to share the knowledge about how leadership matters with all of you. And I'm sure there may be a lot of questions and you may be actually putting them in the chat. I have pre-selected a set of questions based upon what everybody already talked about, and I'm going to field them. So without further ado, I would like to get introduced on the first question. And for our panelists, I would like you to make sure that you are coming up with specific examples on how your responses matter to them. So that'll be great if you can do that, and also fit to a smaller time frame, like 3 minutes or so, that we can rotate as many questions as we can. So let me start the first question. Now, when you look at the healthcare marketplace, there are requests for project managers, healthcare management or health engagement designer, and then product delivery leads, scientists, doctor, pharmacologists, nurses, and designer, tester, and so many different professions exist. But I don't think, to my knowledge, I have seen a healthcare leader, healthcare expert leader. That kind of a position has ever come in my understanding that I haven't seen in any of the job postings. But when you look at the actual people that are hired, the expectation of management and leadership are that they will actually be able to lead towards the results that people are looking for. So the strategic focus on the results delivery. So how much in this context do you feel that the quality of leadership of the people hired in any capacity in your organization matters to your company's success? If so, can you give an example? Bill, I would like to start this question with you.
Thank you for the question. So I think I first have to start with a company really needs to define and reinforce their cultural values and behaviors first, and then find leaders that will align with those. Leadership can be developed, not just hired. And at times you have to change your leadership teams as a company organization grows. And I had to do that a number of times because what got you there may not get you where you need to go. What I would say is once you've defined and you've built an organizational culture that is high performing, you need to make sure that the senior leadership and really all of your leaders in the organization can align around that culture. Because if they're not a fit, you have to take action. So I would say that from a leadership perspective, whether you're leading just a project or you are the CEO of the company, you have to be show your feelings, you have to be vulnerable at times, and you have to be authentic. And so those are the traits that I would look for in leadership and the traits that we instilled in people so that they could become stronger leaders.
Shri, you're on mute.
The standard of the day, right? You are on mute. Okay. So yeah, that's a very good way of telling, Bill. I really appreciate you bringing culture into the fore at the very early stage of our series. As Drucker said, culture will eat strategy for breakfast. And so if the culture doesn't exist, no matter what the strategy is, it's not going to pan out. And at the same time, culture is not top down. Culture is what we create within the organization. So everyone is responsible for culture. Just like if you see it, say it, you have to actually bring everything to the attention of people the right way at the right time in the right place. Which is a very good list of cultural traits that you mentioned and specific traits that you're looking at the personal level. Now, Suga, if I were to turn to you, you come from a preclinical and a clinical setting. Mm-hmm. And you do a lot of design of experiments. The results may be valid. The results may not necessarily prove to be, successful, and things like that based upon the pharmacokinetics and the mechanism of action that you are evaluating for your specific drug, because it's still at the early stages of the drug life cycle. So how do you relate to this definition of leadership, and what do you see in the people that you are hiring or in your capacity that you are seeing people reporting into you demonstrate leadership in the preclinical and clinical setting? Can you elaborate with an example for me?
Sure. Thank you, Shriram. So in my industry, leadership takes more into the how people own things. Like it comes from the ownership perspective. So what I mean by that is whatever they're doing. So every single experiment has small nitty-gritty details, and anything that is missed makes a big difference, not only in the perspective of money or cost, but also there is also loss of life. Because majority of experiments deals with drug production, and in order to test any particular drug, we deal with like different types of animals. What I mean by that is like the rodents or something. So for example, just to give you a quick example, like people walk inside the labs with smartphones, which is not something that is acceptable, but people take it for granted sometimes, and they just walk into a lab where we have mice which is very sensitive to light, and these mice are being dosed with different type of drugs, and every increase in adrenaline hormone or anything makes a big change in how the results are going to come out. So if you expose the mice to a radiation of light that comes from a phone or mobile or smart mobile phones, makes a big difference in the data that we are going to produce. So the simple thing as such things that when somebody takes ownership of an experiment, I would expect them to make it feel like it's their own project and take ownership of this particular project that they are doing. Apart from that, the other thing is accountability. Accountability, what I mean by that is that if I give a project to somebody who is going to lead that, if something goes wrong, it's okay if it goes wrong, but I would like to know that they have to figure out like how it went wrong, what could be done, and be accountable for that. And they should be able to even like troubleshoot it. And the other thing is responsibility. So we have different stages where we have the sample collection, transportation of samples, and analyzing the results and presenting the data and publishing that in a journal. So all this has a several flow where even one gets messed up, the responsibility of one single person who owns this particular flow of the experiment gets messed up, the whole thing is a big loss. So there I need people who owns it as a leader to take the responsibility to make sure that it flows through the pipeline as planned.
Very nicely put. I know people said devil is in the details, but I didn't realize the devil is in the detail until you said the experiment about bringing smartphones and the light sensitivity of that smartphone to the mice. Very interesting opening remarks here. Thank you very much, Suga, for that. And we were expanding certain information that came from Bill in terms of responsibility, accountability, and ownership. Which is something that we always look for in our patterns as well, in our teaching as well, when we try to train people of ownership and stuff like that. So which is very good. But the one thing that I also wanted to differentiate in the point that you mentioned is the behavioral safety elements when it comes to the preclinical and clinical stages, as well as in the drug development process in terms of the people, process, and the environment. People create the process that are consumed to create the environment that they want, which is what goes into the culture that Bill started originally with. So we own, as people, accountability towards the outcome. I recall my manager once said, the efforts matter, but results count. It's the results that are ultimately, count, and how much hour you spend is not, it's irrelevant, but it's not going to count towards the end result, which is very nice because we are bringing all these thought process within a context of a practice, which is very good. And Samir, I would like to turn to you. I know you work in a multi-domain mode where you bring the healthcare into the post-clinical marketing and many other things that associate with post-clinical FDA-approved work. In this particular context of two-dimensional skills, the IT domain as well as the healthcare domain, how do you see leadership play out in this context? What are some of the things that you observe in the people that you hire or have been hired so that they demonstrate leadership?
Sure. Thanks, Sri. So I think there is a common misconception that being cross-disciplinary or cross-functional simply means cooperating across roles and departments. To realize their full potential, cross-functional teams need to be willing to drop some of their traditional, turf-oriented prerogatives and learn to function as mutually invested collaborators. And what I mean by that, if I take an example of all the electronic health records implementations, and Bill, you might be able to connect with this. 95% of healthcare organizations have implemented the technology, right? But the majority of the systems have yet to be optimized for effective use across an organization. And part of the problem being because people will generally say EHR is regarded as an IT issue, and the overall organization is not really engaged. And what I mean by that is because the clinical practitioners are probably not involved early on, there are implications for patient care. So anytime you build a new application, a new system, you need to make sure that you are engaging the right audience, your stakeholders, your end users, when you are building a solution that is going to ultimately benefit the end users. So to give an example, on one of the projects that I was leading, where we had to implement a care management solution at a payer, we made sure that we brought in the stakeholders, the business end users into the mix early on. We made them the product owners, and we made sure that they were engaged from day one. And I think that level of engagement, that level of collaboration is very critical. And that's where, as a leader, you need to understand what could fail if you don't bring in the right parties at the right time. And that's where I would say that, you have to go past the typical boilerplate installation of technology, because that will never work. One solution doesn't work. One solution that has worked for company A will not work for company B. So you need to kind of engage the business stakeholders early on and partner with them and connect them with the technology folks. And that's where a leader would bridge that gap to ensure that those gaps are filled well in time. So what we did on that project was we created Scrum teams so that we actually follow the agile methodology, and we made sure that the product owners created the product backlogs, who would then input product features into that sprint cycle, and the output would be the actual deliverables that would be released into production. So again, the story here, what I'm trying to say is collaboration with the right individuals is critical here. You cannot lead the team all by yourself. You need to collaborate with your business stakeholders, with your technology stakeholders. I think that's where leaders, role plays a critical role here.
Excellent, Samir. So I draw a couple of important points that you mentioned over here, as you particularly mentioned collaboration, working across multiple teams and not necessarily cross-functional, meaning collaboration, and also the application of agility and Scrum over here. Now, the important point is, one of the agile principles that we always say is, technical and business team members should work together, right? Collaborate on a daily basis. And we need that symbiotic relationship more transparent and more visible across all the people. But at the same time, you also mentioned, like, this is where I expect leadership to be present, which is an important point, because when we are forming agile teams or Scrum teams, the expectation is that everybody owns the commitment, which is where Suga was mentioning in terms of, I want you to own your project. If this is your company and your project and your money, would you spend it? If not, well, why are you spending it? And that kind of thought process has to come into every one of us, because collectively we own the commitment, and it is those commitments that make up the actual projects, and those projects that bring the benefits and value to the organization and customer, which is all coming together because all of you using different choice of words, but bringing to the same drum beat here. So which is very nice. I really appreciate these points coming together. Now, I'm sure as you bring the concepts behind agility and people working together and collaborative mindset, and things of that nature that leads to accountability and responsibility, I wanted to ask this additional question. Needless to say that we are all having a pandemic that is stretching our boundaries of every one of the roles. And I'm sure many of us are doing something that we have never done before. And some of us are really going outside of our boundary, outside of our comfort zone to do many things. Now, as the saying goes, when the going gets tough gets going, sometimes we get demotivated because, things rub on us and, we don't have the time to do the things right, although we want to do it right, and stuff like that happens. Now, at that point, because of the lack of motivation, because of the intrinsic drive, rubbing on us, it is potentially possible that we do not necessarily demonstrate leadership exactly when it is required, right? So what does leadership by example, the term leadership by example, mean to you when the going gets tough? Well, do you want, if it's possible that I can start with you again on this question?
Yeah, sure. So I led a turnaround at our company. We were publicly traded when I started the company. We were 59 cents a share and threatened to be delisted off NASDAQ. And the company sold for $39 and $37.40 a share when we sold last year. But in the dark days, and I remember them, and I would talk to employees about them so that they understood that you can't always run the company from the rearview mirror. You have to look forward. And while I experienced them, I learned from those challenging days in that turnaround. But the other thing is, and I have always believed in this quote from Benjamin Franklin that tell me and I forget, teach me and I remember, involve me and I learn. And I want to tell you just a brief story about how we did that. So I have to tell you a little bit about HMS to be able to do that. When we sold the company, 70% of our revenue came from supporting the nation's Medicaid program. And as you know, Medicaid covers those lower income population. It now covers about a third of Americans. And employees were very motivated by knowing that they help people less fortunate than us. People in their communities have access to health insurance. And I was always vocal and passionate about this goal and reminding them of the impact they had on maybe their neighbor in every communication that I did. And that repeated communication worked to be able to get the employees to rise up and perform even greater. And I'll give you an example of some of the bottom-up innovation we did. So we had 60% of our employees who raised their hands to join a volunteer army. If a department had a backlog or a special initiative, a leader could ask through an online portal for volunteers. And by the end of the day, we'd get 20 to 200 people volunteering time to help. Those who did that learned new skills, new areas of business. They grew their own leadership skills and went on to lead these, what we called oftentimes daily, or they could be 90-day sprints. And these could be people working in the mailroom, in a call center, or they could have been the CIO. A lot of innovation bubbled up from that. And what they got to see during that process was leadership leadership by example. And people got to learn new leadership skills through that process. This cultural journey that we did needed innovation, and it needed people at all levels of the company to become leaders. And it paid off. I mean, we had record employee engagement scores, Glassdoor ratings, and of course, business performance. And at the end of the day, everybody wants to be part of a winning team. So I think, again, the things I learned in the early 70s when I first became a leader was leave your emotions at the door. You've got to be a tough guy. I evolved over time and realized that being vulnerable, being authentic, and showing my emotions allowed other people to do that. And I could meet them where they were at.
That's very excellent story, as well as an example of the bottom-up innovation here. Frequently, many think, finding the next slice of bread, or how you are able to transport people from Earth to Mars. Those are innovations, but incremental innovation, there are radical innovations, but at the end of the day, it's the incremental innovations, like what can I do from reducing the cycle time from, I don't know, 40 hours to, 35 hours. That's about 10% of the savings for the company, and the opportunity cost of that particular time being available for other projects, which is very nicely said. And at the same time, you also mentioned about people wanting the leadership in every stage. Everybody should become a leader before actually the company begins to lead. And 90% of the time, I have also seen in my capacity, people come and say, well, that's not what I have been taught. Will this company teach me? Where you are continuously keeping your talent up to date is not a company's responsibility, but your individual responsibility. Technology is changing, many aspects of the world is changing. As a result of that, you need to constantly keep yourself shined and groomed to be able to deliver that value, which is very nicely coming along from your point of view here. Bill, thank you for that. Now, Sughav, from your experience, and I'm sure you mentioned something about the loss of life. I want to maybe connect that with some examples. When people are asked to do some incremental thing regarding the preclinical or clinical experiments, the loss of life could actually come back and haunt them and say, well, let me not take any risk here. I would rather do what is being asked of me to do rather than go out of my realm to do something different. But then you expect leadership, but then we have this loss of life or some change risk management elements that come into play too. So how do you expect leadership by example in your people, with either within the people or the process or within the environmental setting? What are some of the things that you think in terms of how you kept yourself up to date so that you emulate leadership thought process as well? So can you elaborate with some examples that you can share with us?
Sure. So one of the things that, like what you mentioned, we have 3 different stages that we work on: preclinical, clinical, and FDA approval. So preclinical is where we can experiment stuff. So for example, like we can do the experiments in-house with cells, where we can try different things, see if it works or not, and there no life is involved, which means that we do only in the cells which are outside of the human life. So it's just a tissue culture, that's what we call. And then once it moves into clinical and up into FDA approval, we involve a lot of animals, live animals that we use for our study. So coming to your question, yes, there is risk involved, but one of the things that we try to make sure that we don't enter into the loss of life is that whenever before we put anything into a live organism and live animal like mice or something, we make sure that the system works perfectly fine in tissue culture or in the cells that is taken out of. So for example, we test it in blood cells. And then we make sure that the drug that is in the blood cells doesn't kill the cells without like it's not toxic to the cells. And only when we get that get approved, or when we see that that's not happening, then we try to put it in the mice. But on the other hand, like, so here is where leadership plays a role. So there are experiments that failed miserably because people try to do things faster and rush things. So what happens is, like, say, for example, we have a deadline coming in December and we want to get this particular drug approved by or push forward faster before the deadline, by the deadline. Sometimes people don't test it in the blood cells and then directly try to use it in the mice. And so here is a thing where, as a leader, we have to take a step back and say that even if it takes time, even if we are very close to deadline, still we have to test a few things before we put it into the animal, so we can save life, as well as and each animal costs a lot of money. So that is something where a leadership decision takes place. So recently, for example, we had this something happened where we jumped into, so before doing a model development for a particular tumor model, they tried to test the drug on those mice tumor model directly. So what I mean by that is, like, first we have to put a human tumor inside the mice and see how the mice takes this tumor before even you test the drug into a mice that has a tumor. Hope I make sense.
Yes, yes.
So recently, one of the group did this thing where just because we were working on something related to a drug that was also worked by a competitor, we wanted to push this thing faster. So they put the tumor inside the mice, and they also put the drug in the mice without even knowing whether the mice can withstand the human tumor by itself. And all the mice died. So this is where leadership plays a major role, where yes, there are competitors around. Yes, we have a timeline, we have a rush, but at the same time, we have to plan it accordingly so that we don't end up in a big loss rather than meeting a deadline. So there is a very fine line between these two. So like meeting the deadline versus facing a loss. So here are the decision-making comes in place for a leader in the industry. The other thing is, ability to learn. I think one of you already mentioned that, like keeping ourselves updated also happens in pharmaceutical industry. So here, for example, COVID came in suddenly, and all of a sudden we all shifted our focus from cancer drug to COVID. And there we all had to get updated in our like immunology or how we are going to address this, how the immune system works. So ability to learn and keeping updated is something that is very important for a leader in pharmaceutical industry. And also, I think problem solving and decision making skills. So this, again, I think it's very common in any industry, but as far as pharmaceutical industry is concerned. So just now I mentioned that they put the drug directly into the mice with the tumor without even testing whether the tumor can stand in the mice. So there we had a big loss. So at that point, I had to jump into that particular project where I started fresh, and I had to design few experiments and test different type of human tumors in different mice models to see which one suits better, and then take a step back and find out which model works first and then put the drug in. So there I had to make some decision making as well as problem solving skills. So these are the key things that is necessary in my field.
Wow, that's wonderful, Suga. I don't know if I can replicate exactly what you said in terms of the human tumor and all those other wonderful terms. But I think if I were to actually bring it down to the general terms, one of the things that you mentioned in your first one was primarily the cell phone sensitivity and stuff like that. And I'm pretty sure as we learned, we went to college. I don't think I had a smartwatch. I had one of those beautifully designed, time clock with actual analog clock. And now everybody is having, iWatches that they can talk to, and it reminds you, and do so many other things. And so as we come into these fold, we have to learn how these new technologies are supposed to be used. And I always say, use technology, but don't get used to technology. So you have to actually find out when to use it, when not to use it. And your point about standing up, learning to say no by demonstrating the decision-making and problem-solving skills in the leaders is really, coming out. Just because somebody come and said, do it faster doesn't mean better. So you really have to highlight the risks and the impact of the risk on the company and the project and things like that. So I think you are bringing a good element into that fold over here. Now, Samir, if I turn your attention over here, how do you relate to these things? Because Bill's point of view is coming from the post-claim processing and provider processing and those kind of things. I don't think there is a loss of life element associated, unless otherwise somebody did something wrong, which is not something that we need to talk about. But then on the other end, with Suga's point, there is a lot of life impact and mice getting lost, meaning like somebody may come and sue us for you are mistreating the mice, and the live animals are getting mistreated and things like that. So I understand these 2 points, but from the healthcare domain perspective, where you are doing post-clinical FDA marketed space, how are these things resonating with you? do you still feel like, okay, these are still relevant in my particular healthcare domain, or are you expecting different set of attributes by leadership example?
Yeah, so I think if you lead by example, I mean, especially if you're going by my previous experience where I was managing the offshore delivery center, there was a big gap between the US office and the offshore delivery center, right? And we had to bridge that gap because, there was a lot of miscommunication, very poor collaboration. So I worked very closely with my HR to better understand how do we fix this problem. And that's where we said, let's start incorporating a 360-degree feedback mechanism. And what I mean by that is, it allowed employees to be vocal about, and again, this was more of a survey format where employees would receive confidential anonymous feedback from the people who work around them. And then this would typically include employees, managers, peers, and their direct reports. So putting such a robust feedback mechanism, allowed employees to be vocal about what they are seeing wrong. And they could get, again, the person who is being provided a feedback would also be doing a self-rating survey and it would be on the same set of questions that the person would evaluate or self-evaluate. This served as a great development tool, which allowed team members to understand how everyone is pursuing that individual and how he's working, how can he improve the collaboration with other peers and direct reports. I think that was one good learning. If I had to take that as how did I improve the collaboration between both the onshore and the offshore teams? I think that was a great learning where collecting feedback and sharing that feedback with your peers, with your direct reports, and I think that was a great learning in my opinion. That helped us, build teamwork. It also helped improve the collaboration and the character of the overall organization.
That's wonderful. That's wonderful. So I think you are bringing into the stages of team formation that we talk about, like the forming, storming, norming, performing, and adjourning. We basically said different expectations are present with the team members as they become the group. The me thinking versus we thinking versus us thinking, it's no longer my thought process. It's no longer our process, but it's collectively, what our goals are going to be. So only when that happens, we are coming together. Otherwise, that's just a beginning. And then, keeping together, maintaining that collaboration is the progress, and working together when differences of opinion or conflicts arise. Working through the whole process is going to be, the success. So I think all these thought process are coming very nicely over here. It's very good to see the examples that you are all sharing from your practical experience. Now, before I go to the next question, I would like to go back to Les and see if there are any questions from our audience.
Thank you, Sriram, and excellent, great discussion. I'm just very interested in hearing the way you all frame your thought processes, and I appreciate that. Thank you so much. I want to encourage, if anyone please has a question, just drop it into the chat box. We'd love to be able to share that with our panelists. But before we do that, we don't have any just yet, but those who signed up to this webinar identified some individual questions up front and when they first signed on. So I have a few questions that they seem to be interested in. And one of them, we've kind of talked a little bit about this, but and especially when Sriram brought up the issue of the pandemic, excuse me. But I thought this was pretty interesting. Every night when my wife and I, after dinner, we like to sit back and maybe watch the news. It's not necessarily a happy hour because not much good news lately. But that being said, I've thought about this, and this question sort of raises that thought process in me again. And the question is, have you had to change, excuse me, your leadership style, yours individually, the three of you, in what you're doing in response to the challenges that have been posed by COVID? So in your own work environments, have you had to adjust your leadership style as a result of the pandemic? Please.
Yeah, we can throw that question to anybody.
Yeah, I
don't mind taking a first shot at that. So Again, I'll go back to, and we've talked about this, culture trumps strategy, and I think they're inextricably linked. If you don't have a good culture going into a global pandemic, you're not going to perform as well as if you do. And so, because our culture was so strong and we paid attention to the emotional health of the organization, the employees rose up and did things so we had just acquired a company of 1,000 employees, about 750 employees. They had old desktops. They all worked in an office, and we had to move them home. And within 2 weeks, we had our volunteer army helped assemble 700 laptops to be able to get these employees to work from home. We would have never done that and been able to accomplish that 5 years prior, before we started our cultural journey. So we succeeded during the pandemic. But let me tell you what some employees did. So employees built a intranet site called We're in This Together, and they shared stories about how they were helping their communities. How, when you're suddenly forced to work at home, people shared stories about going grocery shopping for an elderly neighbor who could no longer go out because of the fear of catching COVID. These emotional stories pulled the employees together to work even harder to overcome challenges that having 3,200 employees remote brought to us. And we ended up coming out of that very successful. And the company is still using these tools. So part of it is paying attention to the emotional health of the organization, knowing your people, knowing what communication styles they like to, and making sure that you're sponsoring fun. No matter what we're doing, we spend more waking hours at work or thinking about work. So make it fun. Make good, meaningful work is joyful. And the one thing that I always remember is to lead with both my heart and my head. I had to remember where those organs were. But when you do that, employees see it, and they will go the extra mile and move mountains for your clients and your company.
Excellent, Bill. Samir, you wanted to share one thought there as well?
No, I'm good. I think I was to build on what Bill said. I think emotional intelligence is what is critical here. It's the ability to perceive and understand emotions of the people around you. And that was clearly visible in the last 2 years as to how companies came forward, supported their employees. In the place where I work, I'm seeing similar patterns where people are willing to help people who do not have proper work environments at home. Not everyone is blessed to have big homes, and that's where you see people are helping one another to kind of make sure that everyone is, because we are all in this together, and we really don't want anyone left behind. So I think this pandemic has really brought the true character of a person. If I had to say what have we learned in these 2 years, I think the true care that people show for one another, I think that was clearly visible in the last 2 years.
That's very wonderful, Samir. Very well summarized. Suga, do you want to share any other thought before I go on to the next one?
It's pretty much similar to what both had to say. In addition to that, coming from pharmaceutical perspective, we had a different world where we didn't have breaks at all. Which also made us understand that how important our job is, the work that we're doing as a scientist, because when all the other work people can work at home, and that was a time that we were really busy, and we were completely working almost like 12 hours some days, because the previous company that I was working, we were focusing on COVID. It also brought us to think that how important the work that we're doing has a main role, or plays a major role in the society.
Excellent. Thank you very much, Suga, Bill, and Samir. Well, if I were to summarize that particular response to what Les had asked about, we had to change our leadership style. One style doesn't fit. At some point, yes, the transformational leadership may work. At some point, the servant leadership may work. Some point, the situational leadership may work. And, but you have to adapt to the situation. And I'm sure Samir may recall what I used to normally tell. People don't care how much you know until they know how much you care, right? And so if you make sure that you are building trust by showing that care and concern, that is when you are introducing behavioral influence for them. And influence is all about how you demonstrate leadership, right? And so show that you care, and then things will start farming through, because then one important key word comes to our mind called trust. Somehow trust forms, and if trust is there, everything starts building on that foundation. Which is very good. And I know we are running on time here, so I want to respect everyone's time here. So I want to go with one last question to all three panelists before we begin the wrap up. And I'm sure you all remember the Jim Collins approaches, like the good to great. And then finally, he wrote How the Mighty Fall, right? Where he was referring to the undisciplined pursuit of more. The more we are trying to get more and more and more done, the more we are trying to, compromise on certain things. And then, we are wondering what happened here. So the future definitely belongs to a lot of people that will learn and unlearn and relearn and things like that. But bringing the innovation mindset that we talked about, the culture that we talked about, if you had to put all these things together, what are some of the challenges that the leaders of tomorrow still have to address within the healthcare domain? What healthcare related challenges still need to be addressed? I'm sure there's going to be a big laundry list, but if you were to prioritize one or two important things that still need to be addressed and where leadership can be demonstrated, that will be great. I'm going to switch the order, so maybe I'll start with Samir, and then to Sugha, and then to Bill.
Yeah, I think if I had to, capture or a key takeaway to develop your leadership competency, I would say, I would give it maybe 2 points. One would be develop emotional intelligence, and then second one would be one has to strengthen conflict management skills, because if you look at how things have shaped up in the view, everyone working remotely, there has been very little in-person interaction. And then again, workplaces are made up of different personalities, right? So, there will be conflicts, there will going to be disagreements. So as a leader, the way I look at things is, mastering conflict management will create a positive work environment, and that will in turn promote collaboration. So I would say that would be a key skill that we all should try to develop, because developing conflict resolution skills relies heavily on emotional intelligence. And what I mean by that is you have to learn to mediate a discussion or solve an issue between team members, and that is very important, right? While managing conflict, it is important to remain in control of your own emotions. You need to practice active listening skills. You need to understand what the other person would like to say to you. Don't just be a sounding board, but go above and beyond to kind of help that person, use data to solve the problems, and not pointing fingers at the people, but actually look at the crux of the problem. And then what is the core, what has actually caused the conflict? So focus on the problem, not on the people. So that's my takeaway, Shri.
That's wonderful. Thank you very much, Samir. Sugha, any major thoughts in terms of healthcare challenges to be solved?
So just similar to what Samir had said, as a leader, it's always problems with interpersonal relationship in a work environment. It's a constant conflict that we have to always face. And again, I agree to what he said, is being a good listener. And the other major thing that I always we had to come across is inability for the people to change and adapt to during a transition. So one of the examples that I would like to give is that, so for example, we were working on cancer drugs, and suddenly we had to, overnight, we were asked to stop the project and switch to focusing on COVID. So there, people had the inability to change and adapt to the new transition, and there were people who were not happy. Some left the job, some were not ready to adapt to that. So that is another major conflict, that it's not just COVID, but always in the area that I work. we always have change based on what is the priority of the drug, based on what the disease condition, what is flaring up right now. So based on that, we keep changing. And adaptation to change is a big problem that I always see as a leader in the at the industry.
That's great. Emotional intelligence, change intelligence, and adaptation. That's wonderful. Bill?
Well, you started this off by saying, what does it take? What has to change in healthcare? And that laundry list is probably way too long to talk about on this call. But there's part of that word, and that's care. And I think sometimes, no matter what part of healthcare we work in, it's all about caring for people and making sure that we have good outcomes, that we do it at an effective cost, which, as you know, we have the highest per capita cost spend on healthcare out of the industrialized nations, and don't have the highest outcomes from a quality perspective. So I would wrap that up by saying you have to take risks, and you have to coach your employees to take risks. And and this was brought up before, and when they fail, it's a learning moment. It's not a moment to chastise someone. It's a moment to learn. And and we always had a mantra: if you're not failing, then you're not advancing and you're not learning. And so embracing that as a company or as a culture is important. And the same thing in healthcare. And you've seen what's happened where smart money follows problems, right? So what has happened to the behavioral health arena since COVID? We've had significant growth in people with anxiety, depression. $5 billion has been invested in behavioral health since the beginning of COVID. Should it have taken a global pandemic for us to do that? Probably not. So I would say take the risks that are going to move the ball forward, and always remember that in that word healthcare, that word care is critically important.
That's very nicely said. Focusing on the word care of the healthcare, which we were trying to focus before as well. A key important element that at least my parents have taught me is failure is not a failure unless you have not learned from it. If you have learned from something, you turn failure into success, and you make sure that you don't replicate the same failure. Learn something else by failing somewhere else, and keep continuing to move forward, keep continuing to move the needle, and which is all the things that we are trying to repeatedly mention. And a somewhat a shameless plug here, if Les can allow that. My doctoral thesis was on emotional intelligence and its relationship to different types of leadership styles. So that was done about 14 years or so back, and we are still talking about such an impact over here, because at the end of the day, it's all coming to people without emotions. I don't know why we would call them human beings in the first place to begin with. So it's all coming down to people meaning not people at the top, people in the bottom, people in the middle, and at the end of the day, it is you that leadership is expecting you to demonstrate so that the change can be done. I think Mahatma Gandhi's quote is the one thing that I would like to use over here to wrap it up. Be the change agent for the change you want to see in the world, right? Don't expect other people to say, yeah, if only you had done this, that'll be great. I have a problem. Okay, give me 3 solutions or 1 solution. I don't have a solution. Well, then don't make your problem my problem. So, come with a solution so that we work on the solution, we look at the root cause and, figure things out and, advance the solution mindset rather than the problem mindset, which we talked, all the 3 of you brought very good, connections to, and I can't thank you enough. And you are demonstrating right here the servant leadership principles of giving back to the society what made you who you are. And I can't thank you enough from the bottom of my heart. So before I pass it back to Les, as I wrap it up, I do want to, give a shout out to Erin. Erin Johnson, who is the silent force right behind all these things, is the one who is making things happen, doing the recording, getting everything. I can't sing enough of her laurels here, but thank you very much, Erin. And with that, I thank you again, Samir, Bill, and Suga, for your time and your knowledge and sharing that information with all of us. I really appreciate that and wish you all well. Let me pass it back to Les.
Thank you very much, Sriram. We have exactly 5 minutes left. And I'm going to tell you right now, I'm going to take advantage of every minute we have because I'm just really enjoying this discussion and I really appreciate it. So I am going to ask you one final, very quick question. Maybe start with Suga and go to Bill and then finish with Samir very quickly. We pride ourselves, and some of the people on this call are instructors and they're people who teach our students. And if I was to ask you, when people join your organization, they come to you as new employees. Some of them may be very young, maybe in their early 20s, undergraduate degree. Some of them may be a little older, maybe even have a graduate degree or whatever. But if they come to you and you were to say, I wish the college at the undergraduate or even the graduate level had provided them with the following leadership lessons. If I were to ask you, what would you want them to come to you with, at least that they're going to learn as they stay with you, that they're going to mature. But if you wanted them to have something to begin with, what would you say that would be? Suga, can you start us off? What would you want to see in your new employee from a leadership standpoint?
So that's actually a very good question. So if I get a research associate who's fresh from college, one thing that I would expect them is they must have the big ability to listen and they should be ready to unlearn to learn new things. So these are the two things I always expect them to be open so that they can listen and unlearn so that they're ready to learn new things.
Thank you. Bill, what do you think?
I would say, I use this all the time when executives would ask me to meet with new employees, intellectual curiosity. Okay. Always be curious. Don't, and because somebody says that's the way we always do it, challenge that. Because otherwise the company won't move forward and you won't excel. So intellectual curiosity is something that I always look for. And then the other thing is find time, particularly if you're in your school full-time, find time for internships at companies. I mean, we sponsored a high school where it was a very diverse lower income, and we had students who could learn how to work in a business before they went to college. And that was a very, very good experience for them. So, but intellectual curiosity would be my top trait.
Thank you, Bill. Samir, can you bring it home?
Yeah, sure. So I think as Bill and Suga rightly stated, be open to learning new things. I mean, at times, where what you learn in a college is very theoretical at times, but be open to learning practical things. So any outside the college opportunities, learning opportunities they may have, they should always sign up before they join any new company, any community service, organizations, any volunteering services they may, would like to be part of. That would be much more appreciated, so that they get to know what happens in the real world before they join any new company. So I think a community service or a volunteering service gives you a good picture of how the real world functions.
Fantastic. Well, thank you. Those words were priceless, along with everything else you shared with us today. And I want to thank you so much for being a part of this. For the three of you, Suga, Bill, and Samir, thank you for being with us. Really appreciate the time and the fact that you'd be willing to share your ideas with us. And hopefully we can come home and bring you some of those people that you'll say, hey, they're better leaders because they listen to what you said you would like for us to impart on them. And with that, I'd also like to thank our participants. Thank you all those who came and participated. And hopefully you got as much as I got out of this. And Sriram, thank you for moderating. You are You're a great guy. And I can honestly say, having worked with Sriram for many years now, he's second to none. He's one of the best. And with that, Aaron, Sriram was right. Thank you. You're a gold mine, and I appreciate all you've done in putting all this together. And I thank again everybody for being here, and we hope to see you sometime out there. And thank you very much for participating and for your work. Have a great afternoon.
Thanks,
Goodbye,
everyone.
everybody.
Thanks, everyone.
Thank you, everyone.
Bye-bye.
Bye-bye.
Bye.